We often measure our health by our ability to perform the simplest tasks, the capacity to walk, write, cook, pray, or hug a loved one. But for millions of people living with rheumatoid arthritis, those basic daily movements become painful and restricted every single morning. When this discomfort persists, many assume it is an unavoidable consequence of getting older. Others dismiss it as general physical weakness, reaching for oil massages or home remedies in hopes of a quick fix. Treating this level of pain as a routine part of life is dangerous because it delays the medical intervention required to protect the joints. Doctors look for one specific measurement: stiffness in the fingers or joints that lasts past the 30-minute mark after waking up. If that window of morning stiffness is exceeded regularly, it indicates the presence of an aggressive underlying condition, rheumatoid arthritis. Rheumatoid arthritis, or RA, is distinct from the standard wear and tear of aging. It is a specific autoimmune disease. In this condition, the immune system, which is designed to protect you, mistakenly identifies and attacks the healthy lining of your own joints. This internal conflict creates the swelling and heat you feel, often accompanied by a sense of chronic, heavy fatigue. The pain isn't caused by physical exertion. It is the result of the body's own defenses attacking its structure. This process typically begins in the hands and wrists before moving to the knees and feet. Because the immune system travels throughout the body, the damage can eventually reach vital organs, including the lungs, eyes, and the heart. If the inflammation is allowed to continue for months without treatment, it begins to dissolve the bone and cartilage within the joint. Once the internal structure is lost, the joint can shift out of place, leading to permanent physical deformation and long-term disability. Every month that these symptoms go unaddressed increases the risk of irreversible damage to your mobility. Despite the severity of the disease, rheumatoid arthritis is highly treatable if caught before that structural damage occurs. Modern medicine utilizes disease-modifying drugs and biologic therapies that are engineered to intervene in the immune response. Unlike simple painkillers, these treatments target the source of the problem. As shown here, early intervention stops the attack on the joints and stabilizes the condition. Effective management also requires specific physiotherapy and an anti-inflammatory diet to support joint function. By combining these specialized medicines with lifestyle changes, patients can stop the progression of the disease and maintain an active life. Pay attention to persistent swelling, severe unexplained fatigue, and morning stiffness lasting over 30 minutes. If these symptoms appear, bypass home remedies and consult a rheumatologist for a professional evaluation. Awareness leads to early diagnosis, and early diagnosis is the only way to prevent permanent disability. Prioritizing your joint health today is the most effective way of preserving your mobility for the years ahead.